TalkTools is an approach to improve speech clarity and feeding skills, as well as to improve things like drooling in children with and without autism. Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, online course creator, and best-selling author of The Verbal Behavior Approach. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. Today, I'm sharing a small excerpt from podcast number 30, which is an interview with Mags Kirk, who's both a speech and language therapist in the UK for many years and a newly minted board-certified behavior analyst. Mags is an expert on TalkTools, and she's certified in this approach. And she shares with us some of the benefits of using TalkTools as one of the tools in our tool bag. If you'd like to check out the full episode on the podcast, you can go to marybarbera.com/30 or you can click the card on the screen right now. I remember when I spoke in the UK, I think it was 4 years ago, Skybound Therapy brought me in and for a 2-day workshop, I believe. And that's when we met in person, but you were already a part of my online community. And one of the things that really struck me was you and others. There were a handful of you that were TalkTools certified. And I had written actually about TalkTools in my book in chapter 6, the non-vocal to vocal chapter. Lucas, my son, was always vocal, but there were other kids that their speech therapists used TalkTools or some kind of TalkTools procedures, and those moms really felt like that resulted in better language. So can you, for our listeners, just describe what TalkTools is and tell us a little bit about your training and certification in that area?
Sure. So TalkTools is an approach that's very structured, and it's looking at how the muscles function in order to move to the correct postures for speech. So a fundamental concept in TalkTools is the importance of the jaw, which actually, going back into my speech therapy training, was an area which wasn't really covered very much in detail. It was all about what do the lips do, what do the tongue do to make the speech sounds, but actually the jaw wasn't really mentioned. But if you actually think about how much the jaw is moving every time we're speaking, it's going up and down all the time, all these different jaw heights. But what you'll find with the children who've got very unclear speech, or perhaps the ones that are not speaking at all yet, is that they've got a very unstable jaw. They're not able to hold their jaw in the postures that are needed for different speech sounds. So the fundamentals of TalkTools in the basic exercises that child will be doing is probably going to be doing jaw stability. And so TalkTools adopts what we call a tactile approach to teaching children. So most children who are typically developing will be able to perhaps look at the adult to understand how their lips and their tongue and the jaw are moving, and then they'll be able to imitate that. But we do know that a lot of children with autism don't have that imitative ability at first. The other thing that children typically developing will do with speech development is to listen to how the sounds are made, and they'll work out how can I make that sound and replicate it. But again, we know with children with autism, they will often have the auditory processing difficulties, which means that they find it very difficult to attend to speech, to work out what is speech versus what's background noise, how to tune out that background noise so that they can really focus. And so TalkTools will go to the tactile, because they can then actually feel what is needed to make the speech sounds. So in TalkTools, we'll be using equipment to help them feel, my jaw needs to be at this opening of height to make this sound. So for example, we'll work with bite blocks. So those are little plastic sticks that we'll be putting between their teeth, and that will help them to hold their mouth in the posture that we would need for an E sound. Or if we use a slightly bigger bite block, then we'd be making the sound for R, and that would would then be learning, oh, I've got to open my jaw to that height to make that sound. Another thing that we might do in TalkTools is using chewy tubes. So obviously chewy tubes are very commonly used as a sensory strategy for children with autism, but in TalkTools we're using it in a very structured hierarchical approach. So we'll be working with the red chewy tube, which is the easiest one to chew, and getting them to bite on that up to 10 times, making sure their jaw's staying very aligned. So that then they are strengthening their muscles, which is what is needed for speech. And then gradually we'll move through to the harder textures, all the time strengthening their jaw so that they're able to hold it in different postures for speech sounds. Another thing that we might do in TalkTools is working on airstream control. So a lot of the children with autism perhaps haven't got adequate airstream to actually get vocalization going. So we're going to be teaching them this is how we breathe from the diaphragm. We might be using bubbles to get them to use an outgoing airstream. So they get that automatic reinforcement. I've blown the bubble, therefore I see the bubble, and that's going to then reinforce me to try that again. And what we can do with that airstream is then to get them to vocalize at the same time. So we might be pressing on their diaphragm perhaps, and then the airstream comes out, and then we might open their mouth and they'll be saying then ah as they're vocalizing, and then that can teach them to make other sounds. So there's lots of different things that we're doing in TalkTools using the tactile approach to teach them how to speak.
Okay, so that was helpful, and I'm familiar with TalkTools. So some of the equipment, the TalkTools equipment and hierarchy include things like bite blocks, chewy tubes, but it's not just handing a kid a chewy tube and having them chew on it. It's very specific. They have to be sitting up straight. You have to be supporting their jaw in some situations, supporting their head alignment. It's very controlled and hierarchical. What I find is the kids that we have, that the parents and professionals have in my early learner course and toddler course, if they are not talking, if they're non-vocal, they're also usually having eating problems, drinking out of a bottle or a sippy cup, or using a pacifier. They also might have trouble with drooling. So drooling, feeding, talking, it's all intertwined.
It's all linked.
And TalkTools does have the equipment and the care to deal with all those issues. Is that correct?
Sure. So yeah, TalkTools can be quite misleading with the name TalkTools. It implies that actually it's all about talking, but actually TalkTools has a lot of activities that we can use to help with the drooling, with the feeding, as well as just the talking. So one of the main things that I notice with these children that are non-vocal at this point is that oftentimes they will be drooling as well. They might have this open mouth posture. And very often it's related to their muscle function, that they actually haven't had the muscle strength to close their mouth properly. So they might be going around with their tongue hanging out. And so a lot of what we're doing with TalkTools is helping with that jaw stability so that they can put their tongue back in their mouth. And the tongue posture is really important for feeding as well, because what you'll often see is children that are primarily just using a forward tongue posture will only be doing a sucking posture in their feeding. So that's why they're still on a bottle, why they can't drink from an open cup, why they're having difficulty chewing food. And what we see is those children very often turn into very picky eaters or even really restrictive feeders, simply because they can't physically manage to chew the food. And so they then develop all these behaviours around it to avoid the food and avoid that negative experience of not being able to chew the food. And that's where TalkTools really helps with feeding as well as speech. So we would be looking at perhaps how to develop the tongue lateralization skills through chewing. And for that, we would be using real food. So if you're working on feeding, you would be using real food. So we will very often be using some stick-shaped foods perhaps, and we'll be putting those to the side of the mouth to encourage the child to chew better on them. And also particularly looking at how they're swallowing. So we might be using the straw hierarchy in TalkTools, and that is a series of straws that get harder and harder to suck through. So all the time we're working on retracting the tongue, putting the tongue back in the mouth, but also at the same time we're going to be looking at, can they round their lips to suck through the straw, and where do they put their tongue when they're swallowing. So we'll see when they move through the straw hierarchy that they're starting to move their tongue up to the bump just behind the top teeth, the alveoli, alveolar ridge. And as they do that more and more, their tongue is going to start staying in their mouth, which in turn will improve their chewing skills, their swallowing skills, and will have a carryover effect on speech as well. So I've been amazed actually how working on feeding development has an improvement on their speech as well. It just really carries over, and it's brilliant.
Just say a parent is listening and they really want to know more about TalkTools, and
Sure.
How would they get started? And I can't imagine that you have a ton of time for distance consulting and that sort of things, but like, how would they find somebody certified maybe in their area, or how would they proceed?
Okay. Yeah, so if they would go to the TalkTools website, so I think it's talktools.com, we can, there's a database on there that has all the level 3+ certified practitioners on there, so you can do a database search there to find someone. What I would say is if you can find a consultant at that level, that's brilliant, but you will find really good practitioners as well. Anybody who's kind of level 2 and above will be really brilliant to work with. They'll have all done the certification training and will be able to run a program for you, but it might just be worth getting a level 3 to oversee it. It's a very similar kind of thing to working with a BCBA and then perhaps having an RBT do the groundwork hours, or an ABA tutor do the work with your child. Similar kind of structure.
I hope you enjoyed this short snippet from the podcast. If you want more content, check out the podcast at marybarbera.com/podcast. Wherever you're watching this, I'd love it if you would leave me a comment, give me a thumbs up, share this video with others who may benefit. And for more information, you can attend a free online workshop at marybarbera.com/workshop. And I'll see you right here next week.